Now, if anybody's ever experienced vertigo, it's a memorable and unpleasant sort of an experience. You feel like you're sort of taking off in one direction, for example. And there's actually a rather common form of vertigo that's called BPPV, which stands for benign, which sounds good, paroxysmal, which sounds terrible, positional, because it depends on how you move your head, vertigo, so BPPV. And it's a mechanical problem in the inner ear, and it occurs, when some of the calcium carbonate, otoconia, remember those those crystals, those little rocks that are embedded in the otolithic membrane, above the macula, in the utricle, because that's closest to the semicircular canals, become dislodged. And that can happen because, sometimes maybe you hit your head and some of them shoot off. And there can be other reasons potentially why, you lose limestone rocks. But they can actually enter, one of the semicircular canals and become sort of lodged against, the cupula. And they can interfere with sort of the normal fluid movement these canals use, to sense the motion of your head, the angular acceleration of your head. And this can cause the inner ear to send false signals to the brain. And people can really, just because they turn a certain direction, the rocks hit and disrupt, the normal activity, of that semicircular canal, people can suddenly feel like they're, sort of taking off. And, the technique for dealing with BPPV, they used to, they still do in many places. Actually, they rapidly move you from side to side to side. Now, they in some places like at OHSU, they have a very fancy chair they can put you in, and they can program these movements to move your head around, your body around, head around. What they're trying to do is get the little rock out of the semicircular canal, so it doesn't continue to set off, false signals and, give this powerful, impression that you're accelerating in a linear fashion, you're spinning around, you're experiencing vertigo.